Good morning. Welcome back to WTOL 11 Your Day. Some say it doesn't exist. Others, it's just ants in the pants. But when it comes to your child's excessive energy or lack of focus, could it be something more? Psychiatrist Dr. Victoria Kelly joins us this morning with more on ADHD. Good morning. Thanks for joining us today.
Good morning. Thanks for having me.
Absolutely. So October is ADHD Awareness Month, so we want to learn a little bit more about what it is. There are a lot of myths out there.
Yeah, there absolutely are, and it's a wonderful opportunity to take advantage of the month of October, because if you have someone in your life that has ADHD, you're definitely aware of it all the time.
Yes.
So to bring that awareness is great.
So what are we talking about as far as symptoms and age and like when we might see this all start to happen?
Yeah, so there's a few things that it comes to the actual diagnosis of ADHD. There's a few criteria that we follow. The symptoms do have to be present before the age of 12. So regardless of when the diagnosis is made, the symptoms historically have to have been there. From the list of symptoms, you have to have 6 or more of them, and they have to exist in 2 or more settings. So for example, at home and school. And then when it comes to the actual diagnosis, there's 3 types: inattentive type, hyperactive type, or combined type. A lot of times people might say like, oh, I don't have ADHD, I have ADD. Well, officially it is called attention deficit hyperactivity disorder, and there are the 3 types listed there.
Okay, so when we talk about this, I think a lot of people say, well, it's not actually a real thing, it's bad parenting or something like that, but we know that that's untrue, and it really is a real thing.
Yeah, absolutely. It is a neurodevelopmental disorder, without a doubt, and it's been described in the medical literature, the symptoms, since the 1700s and officially since 1902, and it's been described historically as different names: minimal brain dysfunction, hyperkinetic reaction, and whatnot. But what happens is the brain's network of systems for attention, concentration, and focus and organization have gone awry. So if you think about it like you're driving a car and your car's idling, your brain has to decide when to turn it on, when to turn it off, and also using the car analogy, where to steer the car for directing your attention. So that is absolutely well documented through the medical literature for many, many years. And what you see listed here are some of the hyperactive impulsive symptoms: fidget, squirms, difficulty remaining seated. And a lot of times parents get to feel really bad about themselves because they'll hear, you've got to stop babying them, or you just need to discipline them. And it's kind of like a chicken and the egg, and often with a child who might be unable to control their behavior, it kind of brings out not really the great parenting aspects, but it is highly genetic. There's other risk factors like toxins, and there are definite differences in the brain of a person who has ADHD.
Yeah, when you say toxins, I know like lead is something that we talk about, in our pipes and in the homes and these old homes in the area. So really important to make sure those chemicals and those toxins are out of the picture. So, when we talk more about myths as well, I think a lot of people say, well, it's only in boys. It's a boy thing.
Yeah, as you can tell, the list of symptoms that were there, they're kind of in your face, so they're really hard to ignore, especially when they present at school. But the opposite can also happen with the inattentive. So, although it's diagnosed 2 to 3 times more often in boys because it tends to present with a hyperactive, in girls often it presents more inattentive. So what ends up happening is that they can kind of sneak by. It doesn't raise to the awareness of the teachers or home life until later on. And actually, because of that delay, there's some higher incidence of depression, anxiety in females who have ADHD. Again, the earlier you're able to recognize it, the better that it is with the outcome.
Speaking of that,
you don't have to be hyperactive. Yeah, you don't have to be hyperactive to have ADHD. And I think another big myth is that if a child is doing well academically, that means they can't have ADHD. And that just means they have a bigger buffer, and they can perform. However, the emotional distress that comes from it is absolutely there, and they feel exhausted, burdened, a burden to their peers, and underperform.
I feel like we hear a lot about it simply in kids. So is this something that kids can grow out of when they get into their adult life?
Yeah. So interestingly, our brain still develops through adolescence, ends at age 25.
Yeah.
And so about a third of kids will grow out. And what that means is their brains will mature and they won't display the symptoms of it. But about the remaining 2/3 of people will still have symptoms. And maybe the hyperactive symptoms will go away, but the inattentive will remain, or they'll still have just as severe symptoms. So what ends up happening long term is people who have untreated ADHD, that you can have, poor work problems. You end up lots of jobs, lots of relationships, because it's really not good if you can't connect with your partner. They're going to feel hurt by that. Car accidents, early death, problems with the law, even have less earning potential and more debt. So definitely it becomes a problem.
What about addiction? You might hear people connect ADHD with addiction as well.
Yeah, so interestingly, people think, they may think like, oh, stimulants are just drugs in a different way. But what they have found is that, when somebody is impulsive as a kid, they're more likely to make poor choices. And that might include drug experimentation. Mm-hmm. So what the studies have shown, that treating someone with ADHD with stimulant medications actually decreases the likelihood of them developing a substance use disorder. So it's absolutely, treatment is key.
And so if you have a child at home, you think, okay, my child might have ADHD.
Yes,
talk to their doctor, I'm guessing, right, is the first step?
Absolutely. It's always the first step. Speak with the professionals. Make sure the diagnosis is right. They may need a medical evaluation. About 80% of kids and adults with ADHD have sleep problems, so they may be sleep apnea and some other issues. Talk to the school. Make sure you get an individualized education plan, maybe accommodations. And therapy is really key for this. Just treating the symptoms with medications doesn't help you learn new systems and organization on how to do things for the rest of your life successfully.
Great advice this morning, Dr. Kelly. Thank you for joining us today.
Thanks for having me.
Yeah, take care.